Assalamualaikum and hi everyone. Today, our group will be presenting an in-depth analysis of sterile preparation practices, which consists of 10 chapters. We will begin with chapter 1. Okay, next, let's take a look for chapter 1, Introduction to Sterile Preparation. For slide 1, is about key objective and scope of sterile preparation. Sterile preparation are pharmaceutical products that must be completely free from microorganisms, pathogens, and particulate matters to ensure patient safety. The main objective of sterile preparation is to prevent microbial contamination during manufacturing, compounding, storage, and administration. These preparations are important, especially for parenteral, ophthalmic, and irrigating products because they are administered directly into sterile areas of the body. This chapter also introduced clean room environments, aseptic technique and sterilization methods, quality control testing, and proper handling procedure as the foundation of sterile pharmaceutical practice. Next, this slide shows the practical scope of sterile preparation in pharmaceutical practice. The laminar airflow hood provides a controlled aseptic area with HEPA filter airflow to reduce microbial contamination. The clean room environment and sterile gowning procedures further minimize the risk of contamination during compounding. These facilities and techniques are essential to maintain sterility throughout the preparation process. Next slide is importance of sterility in pharmaceutical production. Maintaining sterility in pharmaceutical production is crucial to prevent serious infection and adverse clinical outcome. Contaminated sterile product can cause life-threatening conditions such as sepsis, endophthalmitis, or systemic infection. So, sterility assurance also ensure product quality, therapeutic effectiveness, and compliance with GMP, good manufacturing practice standard, which are essential in pharmaceutical production. Lastly, this slide highlights the importance of aseptic practices in preventing contamination. Proper aseptic hand washing is the first and most important step in controlling microbial contamination before sterile compounding. The comparison between contaminated and sterile injectable products emphasize how poor sterility control can directly endanger patient health. In conclusion, maintaining sterility is essential for safe pharmaceutical practice and patient protection.
Chapter 2: Good Preparation Practice. This slide explains the core principle of Good Preparation Practice or GPP as highlighted in the manual. GPP aims to ensure that sterile preparations are consistently safe, effective, and high quality. The main principles include quality assurance, which oversees all preparation activities, and personnel competency, where only trained and validated staff are allowed to compound sterile products. A controlled environment is required to reduce contamination risk through cleanroom and HEPA filter airflow. All activity must follow approved standard operating procedure, supported by complete documentation and traceability. Finally, strict contamination control practices are applied to protect patient safety. Chapter 2: Good Preparation Practice. This image visually represents the core principle of GPP. Pharmacists check the drug label, expiry date, and dose before preparation. Only trained staff are allowed to compound. Controlled environment is maintained by preparing product inside a grade A laminar airflow cabinet with HEPA filtration. SOP used for cleaning, disinfection, and aseptic technique. Complete the batch record for documentation and traceability. Regular disinfection for contamination control. Next, this slide explains how the core principles of GPP are applied in the preparation of sterile products. During compounding, strict aseptic techniques are practiced, including hand hygiene, proper gowning, and minimal movement. Preparation is performed using validated equipment such as laminar airflow cabinets or biological safety cabinets. All materials are disinfected before entering clean areas, and environmental conditions such as temperature and pressure are routinely monitored. Every step is recorded in batch documentation and the final product is released only after approval by the pharmacist in charge. Next, this slide explains how the core principles of GPP are applied in the preparation of sterile products. This image demonstrates how the core principles of good preparation practice are applied during sterile product preparation. It shows a aseptic technique where the operator performs compounding using proper hand hygiene, sterile gowning, and minimal movement. The use of validated equipment such as laminar flow cabinets with HEPA filter air ensure a controlled environment. Next, material handling is illustrated by disinfecting items before transferring them through the pass box into the clean area. Environmental monitoring is carried out by checking temperature, humidity, and pressure to ensure compliance. Batch documentation records each preparation step, and finally, the product undergoes pharmacy verification and release to ensure it is safe for patient use.
Moving on to Chapter 3 about cytotoxic drug reconstitution. Cytotoxic drug reconstitution is a process of converting a lipophilus powder cytotoxic drug into a liquid form or diluting a concentrate for administration. Cytotoxic drug reconstitution must follow strict standard procedures to ensure patient safety and prevent contamination. Usually, this process is carried out in designated cytotoxic preparation area inside Class 2 biological safety cabinet. And before preparation, healthcare personnel must perform proper hand hygiene and wear appropriate personal protective equipment. The drug name, dose, expiry date, and the diluent must be carefully checked before the preparation. Moreover, aseptic technique must maintain throughout the procedures using sterile syringe and needles. The correct volume of diluent must added into drug vial and solution mixed gently for complete dissolution. Finally, the reconstituted drug is clearly labeled before ready for administration, and all waste need to dispose in cytotoxic waste containers. This slide shows the standard procedures involved in the cytotoxic drug reconstitution that I mentioned in the previous slide before. So the first image demonstrates the drug preparation inside a Class 2 biological safety cabinet which maintains the aseptic conditions. The second image shows aseptic withdrawal of the correct diluent using a sterile syringe. The third image illustrates reconstitution by injecting the diluent into the drug vial carefully. And the final image highlights proper labeling of the reconstituted cytotoxic drug, which is important for correct identification and safety use. Due to hazardous nature of cytotoxic drug, several safety measures are required to protect both personnel and the environment. Healthcare workers must wear full personal protective equipment, including chemotherapy gloves, gowns, masks, and eye protection. Drug preparation should always be performed in controlled ventilation system to reduce exposure. Closed system drug transfer devices are recommended to minimize leakage and aerosol formation. Spills must be managed immediately using cytotoxic spill kits, and all contaminated materials should be disposed in designated cytotoxic waste containers. Regular training and strict adherence to safety guidelines are also essential. This slide highlights the safety measures used during cytotoxic drug reconstitution. The first image shows healthcare personnel wear full personal protective equipment to prevent exposure. The second image demonstrates the use of closed system drug transfer device which reduce the risk of contamination. The third image shows cytotoxic hazard warning signs that alert personnel to potential risk. And the final image represents proper disposal of cytotoxic waste which help protect both healthcare workers and environment.
Next, we will go to Chapter 4, Parenteral Nutrition. This chapter focuses on parenteral nutrition, discussing its preparation guidelines, potential complications, and how to mitigate these complications in pharmacy practice. Parenteral nutrition is given to patients who are unable to meet their nutritional needs through gastrointestinal tract. It is indicated when the gut cannot be used effectively and nutrients need to be supplied directly into the bloodstream. The first one is assessment and prescription planning. Before starting parenteral nutrition, the patient's condition must be carefully assessed. This includes evaluating nutritional status, medical condition, and individual needs. Based on this assessment, an appropriate parenteral nutrition prescription is planned to meet the patient's requirements. The third point is components of parenteral nutrition solutions. Parenteral nutrition solutions are made up of different components, including nutrients such as carbohydrates, amino acids, lipids, electrolytes, vitamins, and trace elements. These components are combined to provide complete nutrition for the patient. Next is vascular access and infusion considerations. Since parenteral nutrition is administered intravenously, proper vascular access is essential. The type of vein and catheter used must be suitable to safely deliver the solution and reduce the risk of complications. The fifth point is aseptic preparation and compounding. Parenteral nutrition must be prepared using strict aseptic techniques. This is usually done in a controlled environment such as laminar airflow cabinet to prevent contamination and ensure the sterility of the solution. Lastly, monitoring and safety. Patients receiving parenteral nutrition must be closely monitored. This slide shows the diagram for preparing parenteral nutrition. First, the healthcare team will review the TPN prescription and patient order to make sure the formulation is suitable for the patient. Next, the order is entered using an electronic TPN system to reduce errors. Then, standard TPN components such as glucose, amino acids, and electrolytes are selected. The most important step is aseptic compounding, which is done inside a laminar airflow cabinet to prevent contamination. After compounding, the solution undergoes final inspection to check for particles, color changes, or leaks. Lastly, an automated TPN compounding device may be used to improve accuracy and safety. Next, we will look at potential complications that can arise from improper preparation of parenteral nutrition and how these complications can be mitigated in pharmacy practice. First, contamination and catheter-related bloodstream infections may occur. This can be mitigated by ensuring that parenteral nutrition is prepared using strict aseptic technique, especially during compounding. Next, hyperglycemia may happen due to high glucose content. To mitigate this, parenteral nutrition should be initiated gradually and blood glucose level should be monitored regularly. Hypoglycemia can occur if parenteral nutrition is stopped suddenly. This can be mitigated by tapering PN slowly instead of stopping it abruptly. Another complication is electrolyte imbalance. This can be managed by frequently monitoring of electrolyte levels and adjusting the PN formulation accordingly. Catheter occlusion or blockage may also occur. This can be mitigated by ensuring compatibility of PN components and using appropriate inline filters. Liver dysfunction is another possible complication. To mitigate this, overfeeding should be avoided and liver function tests should be monitored regularly. Lastly, metabolic bone disease can develop with long-term PN use. This can be prevented by providing adequate calcium, phosphate, and vitamin D supplementation. These are the tables of parenteral nutrition-related complications that summarize the types of complications associated with parenteral nutrition and their management as discussed in the previous slides.
Now let's move on to chapter 5, which is about radiopharmaceutical.
Radiopharmaceutical handling and preparation must follow strict protocols to ensure both patient and staff safety. Only licensed and trained personnel are authorized to handle radiopharmaceuticals. Preparation is carried out in a controlled aseptic environment such as clean room or hot lab equipped with a biosafety cabinets, isolators, or hot cell with appropriate shielding. Before entering the clean room or hot lab, personnel must wear personal protective equipment including sterile gown, glove, mask, head covers, and shoes covers to reduce radiation exposure and prevent contamination. Radiation protection is ensured by applying the ALARA principles, which involve minimizing handling time, maximizing distance from radioactive source, and using proper shielding. To ensure product safety and quality controls and equipment check are performed daily. Proper labeling is essential. Each dose labeled with the patient's name, radionuclide activity, preparation time, and expiry date. Finally, radioactive waste is isolated and stored until the radiation decays before safe disposal. This slide shows the basic protocols for handling and preparing radiopharmaceutical. Preparation is carried out in a designated hot lab to ensure safety and controls. The radioactivity of each dose is measured using a dose calibrator before administration. Proper labeling is essential to avoid errors. Personnel must wear appropriate PPE and use only sterile equipment. Finally, radioactive waste is safely disposed according to regulation. Radiopharmaceutical preparation involves handling radioactive materials that can expose personnel to harmful ionizing radiation which may damage cell and DNA.
To protect staff, it is essential to wear personal dosimeter and appropriate protective equipment such as lead shield and follow the ALARA principles to keep exposure as low as possible. Radioactive contamination can occur if radiopharmaceuticals are not handled properly, leading to environmental exposure. This risk managed by routine radiation monitoring, wet tests, and immediate decontamination of any spills. Proper handling of radioactive waste is critical. Waste must be separated by type and radioactivity level and stored in a shielded container to minimize radiation risk. Next, strict documentation and traceability are mandatory. Every step of preparation, quality control, dosage, and disposal must be recorded, and all radioactive materials clearly labeled with radiation symbols. Finally, access to preparation areas must be controlled and limited to authorized personnel only. This slide shows example of essential radiation safety equipment used in radiopharmaceutical preparation. Personal radiation monitoring devices are worn to track individual exposure. Lead-shielded doors and lead gas vial sheet help reduce radiation during handling. Radioactive waste containers ensure safe disposal and contamination materials, while control drug record book maintain proper documentation. Together, these measures help minimize radiation exposure and ensure a safe working environment in nuclear medicine laboratories.
Now, let's jump into Chapter 6, Quality Assurance and Control. After discussing radiopharmaceutical preparations, where strict handling was required due to radioactive risk, this chapter expands this idea by further focusing on how quality and safety are ensured in all sterile preparations. To begin, it is important to briefly understand the difference between quality assurance and quality control. Quality assurance is a preventive approach. It focuses on controlling the preparation process to prevent errors before they happen. On the other hand, quality control is a detection-based approach where the final product is tested to identify the problems. In sterile preparations, quality assurance plays a major role because preventing contamination is always safer than trying to detect it later. Several quality assurance measures are recommended to ensure the efficacy and safety of sterile preparations, such as standard operating procedures, staff training, equipment validation, and proper documentation. These images show how quality assurance is applied in practice. First, standard operating procedures ensure that sterile preparations are carried out consistently and correctly. Next, validated equipment ensures that all instruments function safely and reliably. Then, staff training and competency records confirm that personnel are skilled in aseptic techniques. Lastly, documentation and records allow every preparation to be traced, improving accountability and patient safety. Moving on to environmental monitoring, this is another key component in maintaining sterile conditions. Environmental monitoring ensures that the compounding environment remains aseptic by detecting both microbial and particulate contamination. This includes monitoring the air for viable and non-viable particles, checking surfaces and equipment, and controlling temperature, humidity, and pressure differences. By doing this, environmental monitoring allows early detection of contamination, which helps to evaluate cleaning and aseptic practices and supports continuous quality improvement. These images show examples of environmental monitoring in sterile compounding areas. First, air monitoring checks for airborne contamination. Secondly, surface monitoring ensures that work areas and equipment remain clean. Next, personnel monitoring makes sure that gloves and gowns does not introduce any microorganisms. And lastly, airflow and pressure control prevent contaminants from entering critical areas. Altogether, environmental monitoring helps to maintain the sterility, protect the product, and ensure patient safety.
Now we are moving on to Chapter 7, Personnel Training and Competency. I'm going to explain about the training requirements for personnel involved in sterile preparation. Firstly, initial training is required before any staff are allowed to compound sterile products. This includes training on aseptic hand washing, proper garbing, cleanroom behavior, and contamination control. Initial training ensures that personnel understand the risks associated with sterile preparation and the importance of maintaining sterility. Secondly, practical skill training is crucial. Staff must be trained in hands-on techniques such as media field tests, glove fingertip sampling, and cleaning and disinfection procedures. This ensures that theoretical knowledge can be applied correctly in real practices. Next, personnel must have a clear understanding of sterile compounding environment, including ISO classification, especially ISO 578, laminar airflow workbenches, and biosafety cabinets. This knowledge helps staff work safely while preventing contamination. Finally, knowledge-based training ensures that personnel understand relevant guidelines and standards such as SOPs and institutional policies, handling hazardous versus non-hazardous CSPs, also beyond use dating, BUD, and labeling. These images are examples of tests mentioned in the previous slide. Firstly, the media field test. It represents a key competency assessment used to evaluate aseptic techniques. It stimulates sterile compounding to detect contamination caused by poor technique. Next, the glove fingertip test assess hand hygiene and glove contamination, ensuring that personnel can maintain aseptic condition during handling. Lastly, the clean room class comparison chart illustrates environmental monitoring and importance of maintaining appropriate ISO classifications in sterile compounding areas. Personnel involved in sterile preparation should know in detail about the ISO classification and are able to conduct these tests flawlessly. Now I'll be explaining about the impact of continuous education and competency assessment. Firstly, continuous education ensures patient safety by reducing contamination and medication errors. Regular training reinforces correct aseptic techniques and helps maintain sterility and product quality. It also helps to maintain regulatory compliance. Ongoing training ensures that personnel meet standards such as USP 797 and 800 and remain prepared for audits and inspection. Next, continuous education also improves overall performance by promoting consistency, confidence, and reducing variability in sterile compounding practices among staff. Lastly, competency assessment helps sustain staff competency by reinforcing correct techniques and identifying skill gaps early so corrective training can be provided. The first image illustrates common medication errors as I mentioned in the previous slide. For example, wrong dose, wrong drug, and incorrect preparation. This may occur due to poor training or lack of competency. Next, the USP 797 and 800 standards image emphasize the role of regulatory guidelines in preventing these errors and ensuring safe sterile compounding practices. I'll not be explaining in detail about these two USPs since it is too complex. Lastly, the sterile techniques illustration demonstrate correct and incorrect aseptic techniques, reinforcing the importance of proper technique during preparation. With continuous education and assessment, personnel are able to maintain correct aseptic techniques all the time.
On this slide, I will explain the key design features of facilities used for sterile preparation. These facilities are designed to prevent contamination by microorganisms, particles, and dust. One important feature is the use of clean rooms, which can be classified based on air cleanliness such as ISO Class 5 or Class 7. Clean rooms helps control the number of particles in the air. Another key feature is the unidirectional air or laminar airflow, which supplies clean air and removes contaminants away from critical areas where sterile products are handled. Positive air pressure is also maintained so that contaminated air from outside cannot enter the sterile area. In addition, walls, floors, and ceilings used need to be smooth and non-porous, making them easy to clean and disinfect. Finally, separate areas for gowning, preparation, and sterilization help reduce the risk of cross-contamination and ensure product safety. This slide shows images related to facility design for sterile preparations. The clean room layout demonstrates how different areas are separated to control the contamination. The laminar airflow cabinet provides continuous clean air over the sterile product, protecting it during the preparation. The gowning area ensures that personnel wear proper protective clothing before entering sterile zones,
and these design features work together to maintain the sterility and product safety. This slide discusses the maintenance protocols necessary to maintain a sterile environment. First, regular cleaning and disinfection are essential. It must follow strict schedules and using approved disinfectants. This helps to remove microorganisms and prevent contamination. Environmental monitoring is also carried out regularly by checking air, surfaces, and equipment to ensure microbial and particle levels remain within acceptable limits. In addition, ventilation system and HEPA filters must be inspected, tested, and replaced when necessary to maintain the air quality of the clean room. Equipment used in sterile preparation also must undergo routine calibration and maintenance to ensure accuracy and safety. All these maintenance activities must be properly documented to meet good manufacturing practice requirements and to ensure the traceability and compliance. This slide shows examples of facility maintenance in a sterile environment. The images include HEPA filters and air handling systems that must be regularly maintained to ensure the clean air circulation. We can also see cleaning and disinfection procedures that are performed routinely to maintain the sterility. Environmental monitoring methods such as air and surface sampling are also shown to ensure contamination levels remain controlled. Proper documentation of these activities help ensure compliance with regulatory standards.
Now for Chapter 9, Documentation and Record Keeping, I'll be explaining about the importance of thorough documentation in sterile preparation process. Firstly, documentation ensures traceability of materials, processes, and personnel, allowing every step of preparation to be tracked. Next, it confirms compliance with aseptic techniques and standard operating procedures, ensuring that correct practices are consistently followed. Documentation also enhances patient safety by enabling investigation of errors or contamination events when they occur. Additionally, proper records support quality assurance, audits, and regulatory compliance, and facilitate product recall, root cause analysis, and continuous improvement.
Next, this slide shows the documentation flow in sterile preparation to ensure full traceability. The process starts with the prescription or preparation request, followed by the preparation record, where compounding details are documented. A quality control check is then performed to verify accuracy and sterility before release and dispensing. Storage and transport log are maintained to ensure proper handling condition. Finally, all records are achieved for regulatory and audit purpose. As highlighted, every step must be signed, dated, and written to ensure compliance, accountability, and patient safety.
On this slide, we can see the main types of records that should be maintained during cytotoxic drug reconstitution and their role in quality assurance. First, drug preparation records document the drug name, dose, and batch number to ensure traceability. Next, reconstitution or compounding records maintain consistency and accuracy in preparation. As for equipment cleaning and maintenance records, it ensures that all tools are safe and functioning correctly. Moreover, environmental monitoring records detect any contamination and help maintain a clean preparation area. And finally, the waste disposal records ensure that cytotoxic waste is handled safely and in compliance with regulation. These are the image examples for different types of records that ensure quality assurance in sterile preparation. The first one is batch records that track preparation details for traceability, while compounding logs document personnel, ingredients, and step. The environmental monitors log record surface and pressure parameters to maintain sterility, and lastly, the competency record shows staff are trained and qualified to perform sterile compounding safely.
Chapter 10, Regulatory Compliance. Personnel must complete training in aseptic technique, pass qualification tests, and follow strict hygiene and garbing protocol with sterile PPE. Cleanroom operation require graded environment, primary engineering control like LAFW or isolator, and ongoing environmental monitoring of particle, surface, and pressure. Sterilization process must be validated. SOP must cover all activity and finished product undergo testing with beyond use date based on stability and risk level. Detailed documentation, including formulation record, compounding lots, and CAPA investigation for deviation is required to ensure compliance and quality. Personnel must complete training in aseptic technique.
This slide shows the regulatory requirements for sterile preparation. Personnel must be trained in aseptic techniques and follow strict hygiene and gowning rules. Sterile work is carried out in controlled cleanroom environments using laminar airflow or isolators with regular environmental monitoring. Sterilization processes are validated, SOPs guide all the procedures, and finished products are tested and given appropriate beyond use dates. All these activities are fully documented to ensure the compliance and product quality.
This slide highlights the consequences of non-compliance and the importance of adhering to regulatory requirements in sterile preparation. Non-compliance can lead to serious outcomes. Institutions and individuals may face legal action if patient safety is compromised. Next, poor aseptic technique and hygiene increase the risk of microbial contamination, which can cause serious infection. Next, inadequate testing and stability assessment may result in product degradation and reduced effectiveness. Additionally, poor documentation and the absence of CAPA lead to weak traceability, making it difficult to investigate error and improve quality. On the other hand, adherence to regulation is essential. It protects patient safety, ensures product sterility, and maintains consistent product quality and efficacy through validated processes. Compliance also prevents product degradation, avoid legal action, promote a strong safety culture among personnel, and reduce costly recalls and wastage, especially for high-value pharmaceutical products.
This slide shows a mind map related to regulatory compliance in the pharmaceutical and healthcare field. On the left, it explains the consequences of non-compliance, such as FDA fines, product recalls, approval delays, and safety issues. On the right, following regulations helps ensure patient safety, product quality, and public trust. It also reduces legal and financial risks.